Whenever we refer to abortions, it's basically the termination of pregnancy. So, in simple words, the termination of pregnancy can be categorized as therapeutic abortions. Therapeutic abortions are basically abortions which are related to the medical causes or some pre-existing diseases which the mother is suffering from. And then we can refer to them as the legal abortions and the illegal abortions. Depending upon the causes, the illegal abortions are basically which do not have any therapeutic cause. There are no causes and they're sometimes carried out against the law of the country, so that are basically categorized as the illegal abortions. In this section, we'll be dealing with the instrumental interference and the insufflation of air, which is basically sometimes referred to whenever these illegal abortions are carried out. The methods in which we refer to for these illegal abortions are sometimes very unsafe. The person who is carrying out these illegal abortions, sometimes he or she is not even authorized enough or skillful enough to carry out these abortions, and so the mother's life is at stake whenever this procedure is being carried out. The methods, we'll be discussing them in detail over here. Sometimes these untrained practitioners carry out the dilatation of the cervix. What are the complications that the person can suffer from? The physical violence is very important. The domestic violence is very important. The syringing and aspiration technique is one of the method which sometimes is referred to for these illegal kind of abortions. On the other hand, some drugs are used for carrying out this procedure, chemicals are used, and intrauterine infections are sometimes the resulting effects for these illegal abortions which are carried out. The deaths from the illegal abortions, a lot of complications sometimes carry out, damage to the viscera, of course. When we said that the person is unskillful, so it means that it can result in the damaging of the viscera. Even the cervix is sometimes damaged. Just because the person is not having enough anatomical knowledge of the area that he's dealing with, and the viscera are damaged. Fistulas are formed, infections are created, sepsis to the bloodstream is created. On the other hand, pelvic thrombophlebitis is one of the complications that is sometimes seen in these kind of illegal abortions that we're talking about. Cervical perforation, as I was talking about, the person who is carrying out these illegal abortions doesn't have enough anatomical knowledge of the area that he's dealing in. Whenever he has the surgical instruments in his hand, he'll be just inserting them without knowing the relations of the vagina and the cervix and the uterus, and sometimes the viscera are perforated and the cervix is perforated, which is very painful and damaging for the mother. The vaginal perforation is one of the complications that is seen in such mothers who have resorted to these illegal abortions. Talking about the instrumental interference, on one hand, it can induce sepsis, it can induce trauma, and all of these are very devastating, and even the person can go into toxic shock syndrome. So it is a very devastating and a fatal condition for the mother. Posterior fornix is sometimes perforated in these illegal abortions. Again, it is one of the trauma that can be rendered to the mother who is carrying out these illegal abortions. Cervical shock due to the toxic shock syndrome that I was talking about, and even due to some severe hemorrhage that can occur at site. Again, the uterine perforations are very important, and the mother can go through these traumatologies, and that will require a lot of surgeries just to correct these perforations. On the other hand, infected endometrium and placenta can be there, and these infections then require a broad spectrum antibiotic just to cover these infections. Air embolism can also be seen in these cases, and fundal perforation is another factor that can be seen in these illegal type of abortions. Now, in instrumental interference, so what can be the results for these instrumental interference? As you can see, it can result in a very infected uterus, and an infected uterus is basically in this kind of a condition. It's in a blackish or bluish tinge is over there, and if you're performing an autopsy and you go through this kind of a uterus, it means that it requires a lot of investigation just to rule out if the mother has gone some kind of instrumental interference or not. Now, the vault of vagina is very important and can be perforated or damaged by the person who is performing these illegal kind of abortions. Instruments may be passed through the coils of intestine as far as the liver is concerned. Even the liver is damaged in some cases, the spleen is damaged, the stomach is damaged. So all these viscera are at stake if the person doesn't have any anatomical knowledge for the procedure that he's carrying out. The penetration of the lower or the mid vagina is again very important, and it can be carried out in a lot of cases. So these are basically the complications that we are talking about in instrumental interference. Canal may be punctured, and these traumas can be suffered by the mother, whosoever is causing these. Whosoever is going this illegal kind of abortion. The external os is sometimes badly damaged in these illegal kind of abortions or the procedures that are being carried out. The damaged contents of the peritoneal cavity, they're again going to cause a lot of fatal conditions for the mothers and resulting in the death of the mothers. So basically, these are the instruments. This is the whole procedure of the suction and the curettage that is sometimes carried out for the abortions. On one hand, we see a speculum is placed in the vagina and a tenaculum is clamped to lip off the cervix and cannula is inserted into the uterus. Just by going through this whole procedure, you'll just have an overlook what instruments, tenaculum, cannula, speculum, all these instruments are basically can be a cause for the infection, can be a cause for the trauma. So the amniotic fluid and the placenta and the fetus are suctioned through the cannula into a collection jar, and the fetus and the placenta are torn apart in this process. So this is the whole process, and the uterine cavity is scraped with a curette to determine whether any significant amount of tissues are remained or not. So even this curettage can cause the damage or the trauma to the uterus. So it can result, the complications can again be bleeding, sepsis, cervical shock. All these complications have to be kept in mind, and we have to even manage these complications in some cases. The insufflation of air, what can be the complications for this procedure? It can be the air embolism. So the dilatation of the cervix can be seen, and it is one of the methods on what are the complications related to this dilatation of the cervix to introduce a tent into the cervical canal. This is basically the procedure which is for this dilatation, and the risks involved for this dilatation of the cervix are the perforation of the cervix, and whenever there is the intervention with some of the instruments, then infection can be one of the complications of this procedure. Physical violence is seen in a lot of countries. Domestic violence is one of the major problems in the developing countries. And frenzied exercise, horse riding, and a severe purging with laxatives is one of the cause for the abortions. Punching and kicking of the abdomen seen in the cases of the domestic violence can be one of the causes for the abortions as well. And deaths from the visceral rupture after this physical violence is the basic underlying cause for the maternal deaths that is observed. Now, syringe aspiration, as we were talking about, in which the placenta, the amniotic fluid, the fetus are suctioned out through the cannula into a collection jar. It is safe as long as the aseptic methods are used. So, if we are ruling out the infection, it is safe. And if evacuation is incomplete, the products of conception, if they are left behind, they can be a cause of the hemorrhage and they can be cause of the sepsis. The use of drugs and chemicals are the other methods which we refer to whenever we are talking about the illegal kind of abortions, which are being carried out in the first trimester of pregnancy, of course. So there can be the use of the local drugs. The local applications include the phenols and the Lysol. On the other hand, it can be the mercuric chloride and the potassium permanganate. Arsenic is one of the drugs, and it has some of the toxic effects as well. Talking about the formaldehyde and the oxalic acid, it's again very important, and it is used for the local applications. The systemic drugs that are used can be the ecbolics. That ecbolics basically are referring to the drugs which are going to cause the uterine contractions. So it can be the emmenagogues. On the other hand, quinine can be used, but the side effects relating to quinine are the synchronism. So it can cause the synchronism because the dosages are very high. In these cases, on the other hand, ergometrine is very important, and prostaglandins, of course, just to cause the uterine contractions and putting the person in labor. So these are the drugs and the chemicals which are used in the first trimesters, and the aminopterin is another drug. Steroids are again used, but they have their own long-term effects. Amniotic anti-meiotic fluids are the drugs. They can be used for the systemic application. Now, talking about the intrauterine infections, the person can suffer from these intrauterine infections, for example, toxoplasmosis, gonadal infections, and chlamydal infections. The person can suffer from all of these infections, and the risk of hemorrhages and sepsis are very high in these illegal abortions. Talking about the uterus, it can be swollen, spongy, and discolored. For example, a bluish and blackish tinge is seen over there. And the serosal surfaces at autopsy may be brownish, especially in the clostridial infections. The endometrium may be ragged, foul-smelling, and even purulent just by the discharges of the infectious material. So, the signs of septicemia with enlarged soft spleen, prominent lymph nodes, and hepatorenal failures are seen in such intrauterine infections, and the kidneys may show the bilateral cortical necrosis. So, this is again another side effect for this intrauterine infections, and the clostridial septicemias, which are characteristic of a bronze discoloration on the autopsy findings. It will have a mottled or a raindrop appearance in such dead bodies, which have gone through these intrauterine infections. So in this section, basically, we dealt with the intrauterine infections and the complications related to the different methods which we deal with in these illegal abortions. So that is the end to this section. Thank you for watching sqadia.com.